related text about Streptococcus pyogenes, though note that LPS endotoxin is from gram-negative bacteria, not strep pyogenes, which is gram-positive. The text seems to discuss endotoxin structure and effects generally, so questions will focus on endotoxins and their immunologic effects. Question 1. Which component of the lipopolysaccharide, LPS, is primarily responsible for the toxic effects seen in gram-negative bacterial infections? A. O antigen. B. Core polysaccharide. C. Lipid A, peptidoglycan. E. Teichoic acid. Lipid. Explanation. Lipid A is the toxic component of LPS that activates macrophages via TLR4 and triggers the release of pro-inflammatory cytokines causing fever, shock, and DIC. Question 2. What immune receptor is primarily involved in recognizing endotoxin LPS from gram-negative bacteria? A. TLR2, B. TLR4 CD14, C. NOD2 TLR9. E. FC receptor. Explanation. TLR4 in association with CD14 on macrophages recognizes LPS, leading to activation of NF-κB and cytokine release. Question 3. Which of the following is not a typical effect of endotoxin release during a gram-negative bacterial infection? A. Macrophage activation. B. Complement activation. C. Tissue factor activation leading to DICD. High-titer antitoxin antibody production. E. Release of TNF-α, IL-1, and IL-6. High-titer antitoxin antibody production. Explanation. Endotoxins are poorly antigenic and do not induce high-titer neutralizing antibodies, unlike exotoxins. Question 4. Which of the following is the primary mechanism by which endotoxins induce shock? A. Activation of adenylate cyclase and increased CAMP. B. Cross-linking of MHC2 and TCR on T cells. C. Excessive production of nitric oxide causing vasodilation. D. Cleavage of elongation factor 2. E. Proteolysis of snare proteins in neurons. Correct answer. C. Excessive production of nitric oxide causing vasodilation. Explanation. Endotoxins stimulate macrophages to release TNF-α and other cytokines, inducing nitric oxide production that causes systemic vasodilation and shock. Question 5. What distinguishes endotoxins from exotoxins in terms of heat stability? A. Endotoxins are heat labile, and exotoxins are heat stable. B. Both are heat labile. C. Exotoxins are proteins and heat labile. Endotoxins are lipids and heat stable. D. Both are heat stable. E. Exotoxins are heat stable. Endotoxins are heat labile. Correct answer. C. Exotoxins are proteins and heat labile. Endotoxins are lipids and heat stable. Explanation. Endotoxins, lipid A, are extremely heat stable, whereas most exotoxins are proteins and are heat labile. Question 6. Which of the following best explains the cause of disseminated intravascular coagulation in gram-negative sepsis? A. Direct activation of platelet aggregation by exotoxins. B. Activation of tissue factor by endotoxin-induced cytokines. C. Increased production of antithrombin 3. D. Complement-mediated erythrocyte lysis. E. Neutralization of vitamin K by bacterial enzymes. Correct answer B. Activation of tissue factor by endotoxin-induced cytokines. Explanation. Endotoxins trigger macrophages to release cytokines like TNF-α, which activate tissue factor on endothelial cells, initiating the coagulation cascade leading to DIC.